Oh, hello, everybody. My name is Charles, and today with my group, I will be presenting on the COVID-19 vaccine. And as you can see, this is our team. This is who helped us do extensive research on the vaccine so we can make this presentation. Like I said, my name is Charles. I'm a high school senior. We also have Jasmine Dilworth, and she is a second-year student studying biomedical engineering at Davis. Alexa, who is a high school junior. Adesua, who is a senior about to graduate from UC Berkeley, and Michael, who's a freshman at UC San Diego. And so first, I would just be giving a general overview about the vaccine, some frequently asked questions and an introduction. And so as you can see, these are a lot of the historic events having to do with the whole pandemic and the coronavirus from when it was first detected until today, and when we reached 1 million cases worldwide, and when the global death toll. And so these are just a few of the large events. And next, just some frequently asked questions about the vaccine. So a vaccine is, by Oxford Dictionary, defined as a substance used to stimulate the production of antibodies and prevent against one or several diseases. And an mRNA vaccine, which is also a fairly new technology in the vaccine world, works by teaching our cells how to make a protein or a part of a protein that triggers an immune response in our bodies. And one of the big things, especially with the COVID RNA vaccine, is how is it developed so fast? And really the best answer I can give you is out of pure necessity, along with the previous knowledge on similar diseases like SARS and the worldwide collaboration that it took to develop a vaccine, as we know, was very big. And next is vaccine history and development.
Yes, so next slide. So the COVID-19 vaccine, as Charles mentioned, was something that was developed really quickly, and it wasn't just out of thin air. There was over 10 to 15 years worth of research on specifically RNA vaccines, but also advanced research that has been done on diseases related to coronavirus, such as MERS and SARS. And so that knowledge was used to develop the COVID-19 vaccine. And then on the next slide, it just shows a timeline of how the COVID-19 vaccine came about within 2020. And yeah.
Okay, so this, I will be discussing how the COVID-19 vaccine works. So let's take a look at the next slide. So one of the biggest concepts of vaccines are that basically the body, once infected by a virus or sickness, the body will have an immune response by producing white blood cells, the T and B lymphocytes, and those white blood cells will remember what they have learned through the process of fighting against the vaccine, or the virus, sorry. So for specifically the COVID-19 vaccine, it takes a few weeks after receiving both doses, or the one dose of Johnson & Johnson, for the body to produce enough lymphocytes for immunity to increase, which is why there's a possibility of infection a few weeks after you're vaccinated. It just takes a little while for the lymphocytes to produce and get situated. You can also get some, after you have been vaccinated, you can portray symptoms while building immunity, just because you are being given a percentage of that virus. So it is in your body, but your body, it's not at a high dosage. So your body is building immunity against it. Now, there are 3 types of vaccine: mRNA vaccines, which is the COVID-19 vaccine, and protein subunit vaccines, and vector vaccines. Particularly for COVID vaccine, we have 3 manufacturers. That's Pfizer, Moderna, and Johnson & Johnson. Personally, I took the Pfizer vaccine, but yes, there's 3 options that you can choose out of. The Pfizer one, you take the first dose, and then up to 21 days after, or actually after 21 days, you're supposed to take that second dose. And then for Moderna, you take the first vaccine, the first dose, and then 28 days go by, and then you take that second dose. And then for Johnson & Johnson, there's only one dose, so there's no timeline, and trying to figure out when you're going to take the second dose and all that other stuff. So that one's just one dose. And you will be recording both of your vaccines on a COVID-19 vaccine card, and you will keep that as a record of your vaccinations.
Thank you. Next, we have why is receiving the vaccine so important? This would have been done by Alexa, but she couldn't be here right now, so I will be doing this for her. And so just a few reasons of the importance of the COVID-19 vaccine. So first and foremost, it will protect others around you. I know a lot of people say the virus has a 95% survival rate in Americans. You know, it's even higher if you are younger, like our age, or some people just don't feel the need to take a vaccine. And really, it's more so about herd immunity, which is the concept that if as many people get it as possible, those who really will be affected by it most won't have to worry about it because everyone else is vaccinated. And it has been proven safe and effective, and natural immunity, as Jasmine touched on, is good, but it is not as effective. And you would also have to have the vaccine prior to develop natural immunity. And so it will help stop the pandemic as it stops the spread of the virus, and it will allow us to return to a normal life, which I think we all want. And so, you know, some more about natural immunity. It may still spread, and you could also get reinfected, and could result in death or other illnesses, which is why we are pushing the vaccine. And I believe next is Mike with how to get vaccinated.
Now that you've learned this much about the vaccine, it's your turn to get vaccinated. The CDC gives 3 helpful tips in order for you to make an appointment. First, check vaccines.gov. Vaccines.gov is a helpful website that provides information on local appointments next to you. You can also check your local pharmacy for local appointments as well. And lastly, your state health department gives information on how to find someone providing appointments near you. And before you make your choice about getting your vaccine, here's some helpful information to help you decide. On the chart is information regarding the efficiency of each vaccine. Some helpful takeaways are that vaccines such as Moderna and Pfizer have really high efficacy, and as a result, your likelihood of being in the hospital or even getting symptoms of COVID-19 are very slim. And here are our sources. Thank you for watching, and I hope you get your